is the KRON 4 Morning News.
That's all ahead on KRON 4 News Weekend. We're going to talk about the growing problem of pharma parties. That's where teenagers share prescription medications taken from their parents' medicine cabinets. We'll have that coming up. Well, until a few years ago, addiction to prescription medications was more of an adult issue, but now more than ever, teenagers are becoming addicted as well. They're even forming so-called pharma parties. That's where they share prescription drugs taken from their parents' medicine cabinets. And joining us this morning to talk about this disturbing phenomenon is addiction specialist Dr. Carolyn Schumann and Dr. Luboff Smith. She's a licensed marriage and family therapist. Both of them work at the Reliance Center in San Francisco. Thank you so much for joining us this morning. Carolyn, let's start with you. Tell us a little bit about these pharma parties, because a lot of parents may not know what's going on here.
Well, the common concept of the pharma party, which has been talked about in the media for quite a few years now, is that kids will come kind of raid their parents' medicine cabinets and get other sorts of random pills from who knows where, bring them together to a social gathering, put them in punch bowls or candy bowls, and so they look very appealing, like different kinds of candy, and take them randomly during the course of an evening, kind of to see what happens. You know, in point of fact, we've all heard of these pharma parties as clinicians in the field. Nobody really knows the extent of this activity and how much it's responsible for initiation of drug use or perpetuation of drug use. But I think what it does, it puts a very dramatic and horrifying image on the whole idea of teen drug use. But I think that the important story here is the epidemic of prescription opiate use, which has been certainly one that's gotten really out of hand in the last decade or so.
What do you think are some of the social conditions that are driving children to this, that has gotten to the point where it is, as you call it, an epidemic?
Well, there's a larger social context of the total use of prescription drugs, especially opiates, in the larger population as well, which is fueled by many conditions. One of them is a new understanding of pain and more prescriptions for pain. But in terms of teens themselves, who are really bearing the brunt of this epidemic, I think, there are a variety of things that lead teens to do that. This is an age of experimentation, so kids want to do something different, and they want to get high, and they have very little ability to understand the consequences of this. They see these medications as being safe. Okay, their parents take them, they've gotten them, they've had their wisdom teeth removed, they've had their ankle sprained, they've had no end of ability to access these medications, and they don't understand the medical and the social harms that come from them. Most teens actually think that these drugs are safe. 30% of kids don't even think that prescription painkillers are addicting.
Yeah. Also, too, at that age, you pretty much think that you're bulletproof, that you can handle anything and you're invincible.
Absolutely. And there are a variety of other conditions that teens face. Kids who are depressed, kids who are struggling in school, kids who are struggling socially, are much more at risk to take this medication than other kids. Kids have a lot of sense of peer pressure, that they actually feel that they need to take this to fit in. Kids sometimes try to self-medicate pain and self-medicate sleep disturbances with this medication. So it's really, they've seen it as part of our culture, they've seen their parents do it, direct-to-consumer advertising, and they want some of that action as well.
Luboff, let's talk a little bit about the center and there is the fact that there is help available for kids.
There is help available. We're the first of its kind. It's completely integrated. It's a combination of medication called suboxone or buprenorphine and psychotherapy component. It's completely individualized. It's outpatient. All the treatment packages are tailored towards one particular client. We work with family, we work with the patient, we work with adults as well. It's confidential.
In general, what are you seeing at the center in terms of the types of people who come in? Does it run across the socioeconomic spectrum?
Actually, it's middle class, because the pill addiction is expensive. Oxycontin pill right now is cost $40 per pill.
Per pill?
Per pill on the street. So you have to be able to afford it. And that's one of the things that are concerning us as parents also as well. Because it's very hard to imagine that your own child,
of course, and parents don't want to believe that.
Yes.
Tell us some of the warning signs that parents should look out for.
The marked change in behavior.
Change in behavior.
If there is any kind of marked change in behavior, please don't say, no, not my child. Please call us.
Also, there's some other ones here that we want to mention as well.
Yeah. Communicate with your teen, safeguard your medication at all times.
Do you mean like locking them away?
Yes.
Okay.
Yes, and count the pills. Don't be afraid to count your pills and ask the children.
Well, at-risk conditions, what does that mean? Be aware of at-risk conditions.
The conditions I was talking about, children who are depressed, children who are anxious, children who are struggling, especially children who have any drug or alcohol use in their family. And this is part of the communication as well, that when you communicate with your child, you really need to be honest about your own family situation, because those children will have a much higher risk, and they need to be able to put that into their own decision-making equation.
And to wrap this up, it seems like one of you touched upon this, so that we need to be aware of this and understand that it is happening. Don't put your head in the sand. These are very popular parties, and if your kids aren't involved, they probably know somebody who is.
Yes.
And it's happening in the middle class for the most part.
And it's happening right now.
Yeah.
The face of opiate dependence and addiction has changed dramatically over the last 10 or 15 years, and that's the part we all have to understand.
Okay. Doctors Carolyn Schumann and Luboff Smith, thank you so much for joining us.
Thank you so much.
Thank you.